Hey guys. So there is a really important topic that we don't cover enough, and I wanted to take a second and do a video about it. And that is the appropriate way to approach your doctor when it comes to talking about opiates. Whenever I go to my doctor or to the ER and they ask me what works best for me, I always ask them in back, do you want the honest answer or do we start at the beginning? Because usually when they ask that question, they're looking for one of two things. They're either looking for you to jump to the strongest thing ever to prove that you are an addict here just to, score pills, or, you know, they are looking for an honestly true answer. And so you really got to figure out which one your doctor is looking for. Um, some doctors, like at the ER especially, it's best to just start at the beginning and let them go through everything. It may take a long time, but especially with ER docs, if you jump to what actually does work, then they're gonna count you as an addict right off the back. But when you are approaching a doctor, let's talk about that. First thing is always approach doctors with dignity and respect. They may be an asshole. They may have no idea what they are talking about, but the prescription pad is in their name, and they are the only ones that can get you help. So, dignity and respect always. You want to appear calm and collected and like you know what you're talking about. Um, which is why you also want to write a list about everything that you need to cover for that doctor's appointment so you don't appear frazzled or frantic or scatterbrained like many of us with chronic pain are. It's just that fog, but you need to fight the fog and fight the stigma and show that you are calm, collected, and put together, and you know what you're talking about and know what you're doing, and you're serious about treatment. And that leads us to the next thing, which is know the right terminology. You can't go into a doctor's office and say, oh, you were addicted to the last medication because you withdrawed when you went off it. Well, that is completely different than addiction. That is physical dependence. It happens with almost all medications. I mean, it happens with insulin, it happens with uh, anxiety medications, it happens with antidepressants, it happens with opiates. Your body becomes physically dependent on the substance. That is different from addiction. If you are not abusing the medication, if you are not, um, you know, obtaining it illegally, craving it, using too much of it, getting it, then that is addiction. But if you're not doing that, then please don't tell your doctor that you are addicted because that is, you won't get anywhere fast at all. So, the other one is allergic. Make sure that you only use the term allergic. If you're really, you mean anaphylaxis, hives, everything, the whole nine yards. That's allergic. If you just had a bad side effect, or it didn't work for you, or you need to tell your doctor that if you had true anaphylaxis, then that is allergic. That's completely different than having a bad reaction. So it's important to know the difference and what you're really trying to get across when you talk to your doctor. And you also want medical documentation to back it up, whether that is your past medical records and what you've gone through with other doctors, or a pain journal. I mean, a pain journal can really go a long way when you're talking with doctors and trying to determine the right course of medications that you're going to take. So take the time to do it. If you don't know what one is, let me know. I would be more than happy to do a video or talk to you. Um, but a pain journal is really important, especially if you are just establishing care. Um, but again, the most important thing, you will never ever get anywhere unless you are kind, courteous, and respectful. And the moment you are not, you are going to be blackballed from every pain office in your area, because believe it or not, these doctors talk and there's not very many of them and they have a pretty close network. So don't piss them off. Um, our doctors are our friends and they are our biggest allies or our biggest enemies. So make sure you treat them with respect. So that's a little bit on how to approach doctors. I hope that it's somewhat informative.